Hi, everybody. Thank you so much for joining us for this conversation with care providers from Ascension, Wisconsin. Today, I'm joined by Dr. Person, and this series of videos that we're doing is really wanting to tackle what does healthcare for us, for women, look like in this new world where we're like everything feels just a little bit harder. And so we want to do a Q&A and kind of demystify some of that and talk through some of our questions and your questions with healthcare providers. And first up today is Dr. Person. Hi, thank you so much for joining us today. I know this is like a weird kind of format, but we're all kind of getting used to it. And so just tell us a little bit about you and introduce yourself before we dig into some Q&A.
Hi. I'm Rachel Persons. I am from, let me mute that. Oh God, sorry. I am actually born and raised in Wisconsin. I grew up out in the country a little ways in Fredonia, which is kind of out by Port Washington. And graduated high school in Germantown, and then I went to college at Carroll College out in Waukesha. I went to med school at Medical College of Wisconsin, and I did my residency here too. So I've been here.
I had to laugh giggle to myself a little bit when I was reading your bio that you studied theater, Spanish, and religion in college, and then became a doctor. Like that's just such a unique combination to have in your background. That's so cool.
Yeah, so when I started college, I did not think that this is where I was headed. I'll be honest. I was fortunate enough to work for a number of years, like just doing regional theater and just kind of living life, enjoying my early 20s. And I decided, I think I was maybe 25, 26. I decided I wanted to go for medical school. So I was I had about 6 years between my undergrad and starting medical school, where I just really got to live life a little bit and travel. And I met my husband during that time, and we got married right before medical school.
Because you had nothing else going on at that time, so why not?
I was bored.
I'm a theater major as well, so that was like a little.
No way.
That warms my heart. Yeah, it's been very sad right now to not have theater in my life. It's been very, very, very difficult. So, what is your area of expertise with your practice?
So I trained as a general OBGYN, which means that I very much enjoy seeing women from, even young women, high school age, all the way through to menopause, 60s, 70s, 80 years old. I love seeing women through the different transitions that we go through in life as our bodies go through different transitions. And I think there's a lot of, I like helping people kind of demystify what they're going through.
Yeah.
Because I think there's a lot of, we live up here a lot, and we're not necessarily aware of what our bodies are doing or what they should be doing and should be doing differently, until we really sit down and talk with somebody that we can really be open and honest with about the more personal aspects of our life. Because I think we don't often have that opportunity.
I think that's especially important because, especially as women, we have like all of these different voices that are telling us like the way that we should be. And I sometimes joke that for me, like should feels like a curse word sometimes, because like, we get just all of these things like, well, this should be fine. I should be able to do that because my friend or that girl on Instagram or, whatever. And like, it's all so, but everything is so, when it comes to our bodies and our health and everything, it's just so personal that if you're just relying on that, it can be, it's suffocating in a way.
Yes.
So.
Well, and I think it prevents you from truly enjoying whatever phase of your life you find yourself in. I think pregnancy and childbirth and the early postpartum period really is one of those times in our life where we have so many voices coming at us about the best way to manage your pregnancy, the best way to have a baby, like, have you lost your baby weight? All that kind of stuff that is just put so much unnecessary pressure on us.
When you're literally at your most vulnerable
Yes.
ever. Yeah.
Yes.
100%.
And you also, especially for first-time mamas, like, you've never done this before and you have no idea really what your body is doing and what it's capable of. And when you have all these people with opinions that are not necessarily solicited coming at you, it's hard to process all of that and come out of it like an intact whole human being that feels in control of themselves.
Totally. Which brings me actually to that next question. Before we get into the Q&A, the questions that have been submitted from our audience, tell us a little bit about your family and your journey to becoming a mom.
So I have two little boys. They are 4.5 and almost 1.5. I had both of my kiddos during residency, which is, now that I'm on the other side of it, sounds absolutely insane, and it kind of is. My first was born about 5 weeks into my intern year, and my second was born about halfway through my last year of residency. So they've been with me this whole time, more or less, and it's really being a mama and having gone through pretty much everything you can think of from an OB standpoint and from a personal standpoint. Yeah. It's been such a valuable, like, firsthand experience for when people want to talk about their strong desire for trying for vaginal delivery after a C-section, or trying really hard to get pregnant and not getting anywhere. I think definitely education, there's no substitute for it, but firsthand experience, for me at least, has been really valuable in being able to meet people where they are and try to help them kind of understand what's happening and how to get to where they want to be. Yeah.
Well, and that's a perfect segue, because one of the first questions that was submitted from our audience was about trying to conceive right now. So I know we've all seen the jokes about, like, there's going to be a big baby boom 9 months from now, but, like, the question really was, should people, if, like, they're working on trying to grow their family right now, is now even a good time to be trying to conceive, given the additional strains in our healthcare system, or should they be putting it off?
So that's a really tough question. And I think you can imagine there's a short answer that's not very short, and then there's a long answer that's much longer. I think on the short answer side of things, I think as far as, like, a healthcare system capacity, I have no concerns from that standpoint. I really don't. And then as far as people who have been trying to conceive and needing help, that's one consideration. If you are a young, healthy mama on trying for second or third baby, and you didn't have a lot of difficulties achieving your first or second pregnancy, there's a little bit more flexibility in kind of how you proceed. If you are a mama that has other healthcare conditions, like the things that we hear that put you at a higher risk for developing severe COVID symptoms. So that would be like high blood pressure, diabetes, liver, kidney disease, or lung problems. Those mamas really should have a discussion with their doctor before intentionally trying to become pregnant. Now, that's not to say that any of us would come down and say, absolutely not, you shouldn't do it.
Yeah.
But I think, as in all things, but specifically in this situation, it is a risks and benefits discussion, and also very much shared decision making. If you are facing fertility difficulties, and the thought of putting it off for unknown period of time is harmful to your well-being, or say you're 39, 40 years old, and a delay of 6 months could have a real impact on your probability of achieving a healthy pregnancy, well, that deserves some consideration too. I don't think anybody, we don't have all the answers that we want right now, unfortunately.
Right.
And we're working with data that is kind of lower quality data. It's called like case series, where we can take groups of pregnant women, and now we're seeing data from China, South Korea, Italy, a couple of places out of the European Union.
Oh, wow.
And now a couple data series out of New York too, where they're seeing overall, it appears in most of these case series that pregnant women with no other medical problems, like we talked about before, are not they do not appear to be at an increased risk for getting sicker than they would have otherwise.
Okay.
That can be a harder thing to package with the other concern about pregnancy outcomes. So you kind of have to think of it as two separate pictures. Like mom is not likely to get sicker than she normally would have otherwise. Pregnancy outcomes. There is some evidence out there that pregnancy outcomes can be a little bit more, there's a little bit more of a question of that. So you can see, they are seeing a potential that there might be a slight increase in rate of stillbirth, rate of early pregnancy loss, and those sort of complications that obviously we don't want to just like hand wave and say they're not important. Clearly they are, but not necessarily a risk to the mother, if that makes sense.
No, that makes sense.
Like her physical safety.
Yeah, and I like how you said it. It's really like it's a risk benefit, like dance, like balancing act. We're trying to, and honestly, anytime you're looking to grow your family, it's a risk benefit.
Yes, definitely.
Balancing act. So this just has this like additional factor of, there's crazy virus.
Well, and the other thing that has been challenging as an obstetrician is a lot of other pregnancy viral infection concerns in pregnancy. We have years and years of data to be able to make really strong recommendations on what the safest way to proceed is.
Yeah.
So we just don't have long-term data on this yet, and it's hard to say. We have good evidence that this virus does not cross the placenta and affect baby.
Okay, that's good.
There's very few cases where it seems that the baby might have been infected while the bag of water was still intact. So baby was infected in utero. But those are very rare cases that we have. Most of the case series that I've seen, they have not seen virus in the amniotic fluid, in the baby's cord blood, or when they've done like the swabs on the baby.
Got it.
They do see that it can infect the maternal side of the placenta, and that's where they think that the pregnancy complications arise from, is the viral effect on the maternal side of the placenta.
Okay.
So that's kind of a complex answer.
Yeah, no, that's good. More, I think, especially in that, in this realm, it's good to have more information than less. And I think you kind of glossed over it, but I want to make sure that I point out. So when it comes to like the actual hospitals and providers being able to handle new OB patients coming in, like that isn't something that you're concerned about at this particular time.
No, not at all. So right now, we, and most of my colleagues that I've spoken with at other healthcare systems are limiting the patients that they're seeing in the office. The way we've been handling it is we are seeing all of our OB patients as we normally would. And that's essentially all we're seeing in the office right now. And the thought behind that is kind of twofold. One, we do not want to interrupt regular prenatal care. And also we don't want to be bringing extra people into the office when we can speak over the phone to handle other sort of GYN concerns, if that makes sense.
It
That
does,
way
and
we're
I'm
not
going to follow up a question about that in a minute.
that way we're not exposing our mamas to additional risk by having additional people in the office, if that makes
Yeah.
sense.
Oh, it
And
does.
we're on our way to rolling that part of it back, where we're kind of opening back up our office hours and slowly bringing more people into the office, because as the lockdown here ends, we're kind of trying again. It's that we're kind of working the balance between risks and benefits and trying to find that happy medium of getting people the care that they need in the safest way we possibly can.
Right. Yeah, and like I have to keep reminding myself that, like, you know, we don't get to some magic date and suddenly we can throw open the gate to, like, you know, like it's the coronation day in Frozen, and like let all the people in. Like it's not like you get to like that magic date where it's like it's done, it's over, it's gone, and we have to like be cautious with that. So when it comes to you kind of mentioned like some things are done over the phone, some things are done telemedicine versus other things are like in office visits. So what's kind of the best way to determine, like, when it comes to OB/GYN care? Is this an office thing? Is this a telemedicine thing? Do I just need to send my provider, like, how do I know, like, if whatever it is I'm going with needs to be virtual or in person right now?
Yeah, I think the best thing to do would be to call your doc's office and just see what their current policies are, because even within our office, things are evolving on a week-to-week basis, which can be a little bit much for us to keep track of, let alone for anybody else who is like trying to figure out if they can come in to talk about their problem or if they need to wait longer. So
Totally.
my approach and my recommendations have been like, seriously, just call. We're here. Even if we're not physically there, we are always available. We've been doing a lot of telemedicine. And it's actually been kind of surprising the things that we are able to at least get the ball rolling on talking on the phone, because a lot of GYN concerns is a lot of me talking with my patient saying, you know, describe what's been going on up until this point. And that description really does kind of help us start down the path to figuring it out. And that we can do over the phone. And we can usually start with there's usually a lot of reasonable starting points that we can achieve over the phone based on that discussion. And then if we don't see the improvement that we would expect in a reasonable amount of time, well, then there's really no substitute to just coming in the office and being examined.
Have you been finding that, like, even with working like with insurance and things like that, they've been adjusting to those telemedicine visits fairly easily?
Yes. There's new federal guidelines for this as well, as far as Medicare, Medicaid being opened up to telemedicine, which has been I think the like rate limiting step for us to be able to achieve this sort of telemedicine model. And now that we've had this event that has kind of pushed us all to find a better way, I think we're all figuring out that we're able to achieve a lot more things than we thought we would be, just by speaking.
Yeah, it does. Yeah, and it's actually kind of, it has me a little bit excited to see, like, I have to find something hopeful to hang on to. And like, there's so many things that I keep thinking about, like, that they're going to be so different when it's all, like, when we go back to normal, so to speak. But like, there'll be more access to telemedicine with our healthcare. There'll be a lot more employers that are open to remote work, like things like that. I think are really going to start to shift, and which is kind of exciting. So.
Well, and I personally am really hoping to keep telemedicine as part of my practice, even whenever go back to normal, whatever that looks like. I really hope that I'm able to keep doing these telephone visits, because I think especially on the patient side of thing, if you are going to take time out of your workday to go to see a doctor, you think to yourself, well, a half an hour to get there, then the appointment, by the time I actually get there, get in, get seen, and get out of there, it's going to be an hour, and then another half an hour back to the office. Like, that's 2 hours out of your day versus we talk on the phone for 20 minutes.
Yeah.
So I think there's a huge convenience factor there from the patient side of things. And I think we're obviously learning as we go with so much of this right now, but I think the potential is really fantastic to be able to give good care in a much more convenient format.
Yeah, it's super exciting. It's super exciting. And we could talk more about all of this for a long time, but for the sake of time, we are going to wrap up. But are you, just a couple quick, like, final questions. Are you accepting new patients right now?
Yes.
She is. Excellent. We're going to have a link to Dr. Person's bio in the description of this video so that you can head right there to get to know her better and connect with her and schedule an appointment. And where do you, location-wise, practice out of when it's not, like, you know, when we're not talking to you from your living room?
When the world is not crazy.
Yeah.
So I see patients at my office in Wauwatosa. That's at the corner of Highway 100 and Blue Mound. I always tell people it's right by the Starbucks. Yes. Everybody knows where that is. There's an Ascension building right next to that Starbucks. And then, so I do minor procedures there at the day surgery too. And then I do my more complex surgeries and my deliveries at St. Joseph's in Milwaukee.
Perfect. Thank you so much for all of that information today. It was so helpful. Stay safe out there, stay healthy, and thank you for continuing to go in and take care of mom. Thank you.
Thank you so much.